Y a partir de este momento, Montgomery al Día. Un programa presentado por el Condado de Montgomery con el objetivo de mantener a la población latina informada sobre todo lo que acontece en nuestro condado. Un espacio informativo para que usted obtenga acceso directo a los servicios de su gobierno local. Aquí da inicio Montgomery al Día. Queda con ustedes la presentadora de este programa y portavoz hispana del Condado de Montgomery, Lorna Virgilí.
Así es. Muy buenas tardes, queridos amigos. Bienvenidos una vez más a casa. Montgomery al Día, su programa oficial del gobierno del Condado de Montgomery, galardonado a nivel nacional. Y una vez más, desde mi casa, esta transmisión en vivo, recordándoles que estamos en el Facebook Live de Radio América. Por favor, inicie esa sesión y también comparta. Hoy es oficialmente el día 385 que en conjunto venimos dándole frente a esta pandemia, a esta crisis del COVID-19. Y hoy también celebramos el 9º aniversario de este programa, Montgomery al Día. Tenemos de invitado especial nada menos y nada más que a nuestro ejecutivo del condado de Montgomery, Marc Elrich. Mr. County Executive, how are you?
I'm good. How are you?
Muy bien, muchísimas gracias. Siempre acá en el programa, primero hacemos un check-in. Nos gusta preguntarle a nuestros invitados cómo están, cómo está la familia, cómo le ha ido con esta crisis, señor ejecutivo.
My family is fine. This crisis is never ending.
Mm-hmm.
So it's very wearing. This is, 13 months of
Exactamente.
kind of constant disaster management. So
Esta,
that's really hard.
Para la familia de él está bien, ha sido difícil el manejo de esta crisis. 13 meses que continuamos dándole frente a esta pandemia, ha sido dificultoso, obviamente, pero aquí seguimos. Here we are, again, day 385 officially that we've been at it. Let's get started, Mr. County Executive. I'm glad to hear that your family is doing well, that you're doing well. And let's get started with case positivity rate in the county. How are we doing? Cases are creeping up. Slowly but surely, and unfortunately, we continue to see death in the county. Where are we? Where do we stand? And what is the message for our population?
The basic message for the population is that this isn't over yet. Until everybody gets vaccinated, or at least until most people have gotten vaccinated, this isn't over. The county, we had good numbers yesterday. We only had 72 new cases. That was a drop. Our test positivity is 3.3%. We, have some of the lowest rates in the state. Other than a couple of smaller counties, our rates are well below the rates that other people have had.
Let me go ahead and translate that. Básicamente le preguntaba cómo estábamos con el tema de la positividad de los casos en el condado de Montgomery. Hay cierto nivel de preocupación porque las cifras continúan en aumento, pero en el día de ayer el condado de Montgomery solamente vio 72 casos nuevos adicionales confirmados positivos. Lo que es la tasa de positividad, estamos al 3.3%, que es una de las más bajas en el estado de Maryland, sobre todo en comparación con otras jurisdicciones, muy por debajo de otras jurisdicciones. Would you like to continue?
Yeah, so, our positivity rate, which is the percent of tests that come back positive, is 3.3%. That means about three people out of 100 are testing positive of the people who get tested. And our cases per 100,000 are just above 10%. And most of the state is up around 20% or higher.
Vamos a hablar un poco sobre las estadísticas, los datos, las cifras en cuanto a lo que es la positividad de los casos. Estamos en este momento aproximadamente al 3.3% por cada 100 casos positivos y estamos a nivel de lo que es cada 100,000 personas que viven en el condado, estamos un poquitito sobre el 10%, pero aún así muy por debajo del resto del estado, donde hay jurisdicciones que están al 20%. Still, we need to continue testing, correct, and taking the absolute precautions that are necessary that we've been talking about for 13 months.
Yeah, the testing is really important because not only it tells us if you're sick, but we're very concerned about the spread of two variants. One is the what's the British variant, and the other one is the Brazilian variant. Both of them spread more easily, more quickly than the original virus that we've been dealing with. And the Brazilian may have more ill effects attached to it than the original virus. And so we know that it's entered the county. We know both of them are in the county. There's more of the British variant now than there is of the Brazilian, but we need to know where it is so we can be sure we're able to stop it as soon as possible. So this is a big issue for us. Testing is very, very important.
Let me go ahead and translate that, Mr. County Executive. Básicamente, haciendo hincapié en el tema de lo que es hacerse la prueba del COVID-19. ¿Por qué? Porque ya hemos visto la propagación de dos cepas, dos variantes, la británica y la brasileña, dentro de nuestro condado de Montgomery. La brasileña, pues, tiene la efectividad de propagarse aún más rápido, teniendo algunos síntomas diferentes, y es importante para nuestras autoridades el saber precisamente dónde están estas variantes, estas nuevas cepas dentro de nuestra comunidad, para poder ponerle un alto, poder paralizarlo. Recordando que tenemos localizaciones y horarios para hacerse la prueba gratuita a través de nuestro condado de Montgomery los 7 días de la semana. I just added that we have availability 7 days a week. You understand? El ejecutivo entiende mucho de lo que hablamos acá en español. Let's talk about now vaccine. That is the hot topic. Can you give us a little update on vaccine supply for the county? We've seen the numbers of doses increase from the state, federal government, and suppliers, and also the vaccination process, taking into account that as of basically today and next Monday, all residents over 16 years of age qualify to pre-register for the vaccine. Vaccine supply, where are we?
Where are we with supply? Not as good as people had hoped we would be. There was a problem with Johnson & Johnson production where they lost millions of doses they weren't able to use. The additional supply from Pfizer and from Moderna hasn't come quite as quickly as we thought it was going to be. But the county is now getting the county health department is getting about 10,000 doses a week. And we're opening up a mass vaccination site.
Let me go ahead and translate that before we transition to the mass vax site. Le preguntaba sobre lo que es las dosis, cuántas estamos recibiendo. Desafortunadamente, la fábrica de Johnson & Johnson tuvo problemas con la fabricación, donde perdieron millones de dosis, y las dosis de los fabricantes Moderna y Pfizer pues no han sido tantas como se esperaban, pero a la misma vez el Departamento de Salud del Condado de Montgomery está recibiendo aproximadamente unas 10,000 dosis semanalmente por parte del estado de Maryland. Esto sin tomar en consideración lo que va a ser el centro, la clínica de vacunación masiva, de la cual nos va a hablar ahora. Let's talk about now about the mass vaccination site at Montgomery College in Germantown.
So it is open right now as a regular vaccination site, but on Wednesday, the 8th, it graduates to being a mass vaccination site. And we will be able to do, for the first week, we're going to get somewhere between 6,000 and 8,000 doses. So that'll be in addition to the 10,000 we're giving out through the health clinic. This is an additional 6,000 to 8,000. And then as we move forward, it's supposed to build up to 3,000 doses a day or 21,000 doses a week.
Let me go ahead and translate that. Is a lot of numbers. La nueva clínica de vacunación masiva en lo que es en el recinto de Germantown del Montgomery College, abre oficialmente con la colaboración del Estado en el día de mañana. Para esta primera semana se van a recibir entre 6,000 y 8,000 dosis adicionales, pero sin embargo, mientras vaya avanzando el proceso de vacunación, se espera recibir unas 3,000 dosis diariamente para un total de 21,000 dosis semanalmente en el condado de Montgomery. Mr. County Executive, is there a percentage set aside only for Montgomery County residents from that state mass vac site?
So for this week, we're getting about a quarter of the doses, 25%, about 2,100 doses, I think, set aside. And then as the number of doses increase, we expect our set aside, the percentage that will probably stay the same, but the number will obviously increase. And then after that, then it's open to anybody. So Montgomery County residents can register for the rest of the doses. And there's many county residents, whoever registers first, whether it's a county resident or from outside the county, they will use up the additional slots. So we expect more county residents. And just so people know, it's the same as it is now, where many county residents are going to Prince George's County and Baltimore and Salisbury and getting vaccinated at their mass vaccination sites. So this isn't a county site. It's technically a state program. That's why everybody can register after our set aside.
Let me go ahead and translate that. Just un resumen de la respuesta. Le preguntaba si en lo que va a ser el centro, la clínica de vacunación de Germantown, del Montgomery College, si van a haber dosis específicas destinadas solo para los residentes del condado de Montgomery. Nos dice que esta semana aproximadamente el 25% va a ser para los destinados exclusivos para los residentes del condado de Montgomery, tomando en cuenta de que esta es una clínica del estado donde pueden llegar a vacunarse residentes de otras jurisdicciones, así como residentes del condado de Montgomery han ido a vacunarse al condado de Prince George's, a Baltimore y a Salisbury. I kind of like did a quick translation of all of that. The site is already ready. It's been operating since last week. A couple of things that are kind of important for equity, the folks that are perhaps Hispanics, Latino, the Latino community in the county. Will there be, if you know, bilingual staff at this site and all of the sites in the county? And also talk about the transportation, the free transportation with ride-on from the Shady Grove Metro Station to the Germantown site, which is important.
So we're starting up using a shuttle that'll go from the Shady Grove Station. We're continuing to keep the ride-on free, at least through June right now. So people can take ride-on there, they can take Metro there, but if you take ride-on, the ride-on is going to be free. And then we will shuttle people to the vaccine site at the Germantown campus. So we're trying to make sure that people get accessibility to it. When we do this, we'll be opening up another site in the county for not mass vaccination, but to help people in the Up County get vaccinated when this site transitions from being a county site to a mass vaccination site.
So did you just say that we're going to open up another site up county? Is that what you said?
One of our more traditional vaccine sites. We started at the college because they were opening schools and we lost 2 school sites. Okay. So we're replacing the 2 school sites. We started one of them. They moved over to the college, but the intention is then to add on another site in the Up County. So people who don't go to the mass vaccination site can still get to a site close by in the Up County.
Do we know where or not yet?
Not
saying yet? Okay, all right.
Yeah, we're not saying.
Okay, we're not saying yet. Okay, entonces, para traducir en resumen lo que acaba de decir el ejecutivo, importante para el acceso, sobre todo aquellas personas que utilizan el transporte público, no solamente en el metro, pero que los autobuses de Ride-On, la flota del Departamento de Transporte del Condado, es gratuito, el peaje hasta finales del mes de junio, y aparte va a haber servicio de autobuses desde la estación del metro de Shady Grove hasta el recinto de Germantown del Montgomery College para que las personas puedan utilizar el transporte público y llegar a vacunarse. Más adelante, aún no estamos divulgando dónde, se va a abrir otra clínica más pequeña en la parte norte del condado de Montgomery para aquellas personas que no quieran llegar a lo que queda establecido esta semana ser la clínica de vacunación masiva. Now, let's talk about appointments.
Yeah.
Where do people go to get appointments? Because at the beginning it was register with the state, register with the counties, register with the individual pharmacies. How are we now collaborating a little bit more with the state where people that perhaps are already registered with the county will perhaps get appointments for the mass vaccination site here in Montgomery County?
So the people that we register will be sending over to the state for whatever we're allocated out of the list of people that we've pre-registered. And then regular county residents who don't get sent over can still go to the state site and sign up for the mass vaccination site there. In addition, the hospitals are still doing their own thing. Mm-hmm. The pharmacies are still doing their own thing. It's still individual registration, unfortunately.
Okay, let me go ahead and translate that. Siempre, desde que comenzó el proceso de vacunación, ha habido un poco de duda, de confusión con el tema de obtener las citas y el preinscribirse. El condado va a comenzar a compartir la lista de sus preinscripciones con el estado para que algunas de las personas que ya están preinscritas con el condado puedan obtener cita a través del sistema del estado. También está el proceso de preinscripción directamente con el estado de Maryland y de los establecimientos particulares como las farmacias que ya conocemos. Let me go ahead and give those phone numbers right now, Mr. County Executive. Sure. Preinscripción con el condado de Montgomery, 240-777-2982. 240-777-2982. Preinscripción con el condado de Montgomery, 7 días a la semana, desde las 8 de la mañana hasta las 6 de la tarde. Preinscripción con el estado de Maryland, 855-634-6829. Una vez más, 7 días a la semana, desde las 7 de la mañana hasta las 10 de la noche. You just mentioned, Mr. County Executive, perhaps the opening of another clinic, vaccination site somewhere in
the Up County.
Okay, Up County. Wheaton and Silver Spring, those should be coming up, or are they operating already?
Silver Spring should be operating. We're opening at the the Civic Center in Silver Spring. I think Wheaton is not far behind. So I get my briefing again tomorrow. I'll know what the status of all these things are. But
okay.
We are opening, we've got facilities on the east side of the county. We have been getting vaccines out. We have a program that you can contact Salud y Bienestar. You can contact the county, and we're doing home visits for people who can't get out of their homes. And we're beginning to work with a couple of providers who will be doing mobile clinics coming to neighborhoods and coming to apartment complexes so we can actually reach people who may have difficulty with transportation or just with mobility.
Okay, let me go ahead and translate that. Let me go ahead and translate that. En el condado de Montgomery ya tenemos una clínica, otra clínica de vacunación en la zona este del condado. Próximamente, no solamente el centro cívico de Silver Spring, sino que también en Wheaton va a haber clínica de vacunación a través del programa de la iniciativa por nuestra salud y bienestar, unidades móviles también con otros proveedores, precisamente para llegar a los vecindarios complejos de apartamentos para aquellas personas que quizás no tienen la movilidad para llegar a las clínicas. Let's talk about salud y bienestar por nuestra Salud y Bienestar Initiative. Ese número de teléfono 301-270-8432. So promoters have been getting ready. People have been getting the training. How through the Por Nuestra Salud y Bienestar Initiative are these clinics going to get into the community?
Are they going to get into the community?
Yeah, how specifically? It's going to be pop-ups? It's going to be the mobile
Yeah.
units? Okay.
They'll either look for community spaces or they'll be looking for pop-ups.
Okay.
And there may be, I talked to one group that actually is looking at vans, van where they'll be having the supply, where they figured out how to maintain a freezer. And then they'll also be using potentially, it could be tents. So we're looking at every way we possibly can to set these things up and make sure that we can get people out of the apartments and into getting vaccinated.
A través de la iniciativa por nuestra salud y bienestar, que es manejada por la Iniciativa Latina de Salud del Condado de Montgomery, vamos a tener clínicas, lo que se llaman en inglés pop-ups, clínicas que en espacios comunitarios se lleva a cabo una clínica específicamente por un día, igual que las unidades móviles, y también tomando en consideración la posibilidad de este tipo de vehículos, estilo vans, que tengan algún tipo de refrigeración, poder llegar adentro de las comunidades para poder vacunar directamente a las personas. En este momento, the clinical partners are receiving the training and making all the preparations to begin the administration of vaccine in the communities as soon as possible. And it all has to do with having the vaccines, having the doses, correct?
And so that'll be the limitation. The governor continues to tell people that everybody's eligible. The problem is that we don't necessarily have enough doses to meet the expectations. And so more people will be trying to register and more people will be trying to get appointments, but we still don't have enough doses. For example, I only know 4 weeks in advance how many doses we're going to have. So we know for 4 weeks we'll have 10,000 doses each week. Mm-hmm. That's what we can register, or that's what we can schedule. We'll know with the mass vaccinating site that if they get to the point where it's 21,000, we'll be able to register 21,000 a week. But we continue to be limited by supply.
Exactamente. Continuamos, pese a todas estas elevadas expectativas, las planificaciones, pese a que el gobernador del estado de Maryland pues ha dicho que básicamente todas las personas mayores de los 16 años se pueden preinscribir. Básicamente, las expectativas son difíciles de poder lograrlas precisamente por los límites en las dosis que se reciben, que no son suficientes, y acá en el condado de Montgomery, pues al Ejecutivo y al Departamento de Salud les dejan saber con 4 semanas por adelantado cuántas van a ser las dosis que se van a estar recibiendo semanalmente, y estamos hablando que ahorita son unas 10,000 por semana. We have about 5 minutes left. Let's talk about something really important for the Hispanic community, and we're going to have a separate show about the rental assistance program.
Yes.
There's going to be the relaunch coming up
very soon.
Very soon.
Yes.
Very soon. So how many millions do we have this time around? What are the expectations, and what can people be doing now to get ready for when it is officially announced that it's being launched?
Wow. So
yes,
they were still putting together the regulations. Okay. And making sure the 311 will work and that people can get directed to where they need to be directed to, which is why I'm not specific about a date, because I hear some fuzziness out there. It could be the end of this week. It could be the beginning of next week. But there's that little bit of just making sure that we're technically able to handle the requests. It is largely federal money. We're looking at, I think, again, more than $20 million. There may be more money on the way. So, there will be, I think, substantial amount of support. I know that when we had a conversation with an official in the Biden administration, they recognized that they would need to provide support beyond the end of the pandemic, because if you lost your job during the pandemic, there's no guarantee that the day the governor says it's over, that the businesses are going to open again.
Let me go ahead and translate that. Le preguntaba al Ejecutivo sobre el próximo lanzamiento de fondos adicionales para el programa de asistencia con el alquiler para los inquilinos. Posiblemente el condado esté anunciando la fecha oficial a finales de esta semana o a principios de la semana próxima. No tenemos la fecha específicamente porque se están trazando lo que serán las regulaciones y que también nuestro centro de operadoras del 311 esté disponible. Sabemos que va a ser un fondo con una cantidad sustancial para apoyar a las comunidades, y también mencionaba el ejecutivo que hubo conversaciones con oficiales de la administración del presidente Biden a ver cómo se puede continuar este tipo de asistencia una vez que culmine la crisis, porque sabemos que cuando termine la crisis no necesariamente las personas de inmediato van a estar trabajando porque los negocios no van a estar operando inmediatamente. We have just a couple of minutes left, Mr. County Executive, so TBD for when it comes to the rental assistance program, we'll get it out to the community as soon as we're ready to go. Y el número telefónico más adelante para la asistencia con el alquiler, recuerden, es el 311, nuestro centro de operadoras en el condado de Montgomery. Are you going to be asking the governor to scale back a little bit on his reopening decisions, restaurant capacity, indoor dining, all of that good stuff?
I have asked him. I have asked him and his staff more than once. I mean, since he opened up this state, the numbers have gotten much worse. Much worse means a lot more people are getting sick than were getting sick before. That means more people are dying than were dying before. So, we think it was too fast an opening. And I know everybody wants to get back to normal, but until people are vaccinated, getting back to normal is not going to be a quick thing. And I just wanted to add on the vaccination, so people, when I tell people to be patient, to understand why. If we get 20,000 doses from a mass vac site a week, and if the county, between us and our partners and everybody, were to get to 30,000, which we're not at yet, we'd have 50,000 doses a week. At 50,000 doses a week, there are still probably 60% of our population, maybe somewhere around 550 to 600,000 people who aren't vaccinated yet.
Let me go ahead and translate that. Let me go ahead and translate that real quick. Le preguntaba sobre el proceso de reapertura. Rápidamente voy a traducir. Varias ocasiones le ha pedido al gobernador, le ha dicho al gobernador, a los funcionarios del estado, de que ha sido pues demasiado apresurada la reapertura. Hemos visto reincidencia en cuanto a las cifras de casos positivos, y hablando de la vacuna, paciencia para nuestra población por el simple hecho de que cuando llegue el momento que recibamos un total, esperemos, de unas 30,000 dosis semanalmente, aún falta el 30%, el 60% de la población por ser vacunada. Quiere decir que en el condado quedan unas 550,000, 600,000 personas que aún se tienen que vacunar. I'm sorry, Mr. County Executive, our half hour flew by very quickly, but before we are gone, before we say goodbye, I want to say this is the 9th anniversary of this show.
Yep.
Montgomery
Happy anniversary.
Al Día. Thank you for your continued support for it. As you know, this is a very important tool for the members of our Hispanic community to continue to be informed about programs and services in our county. One last word to say goodbye from you.
So look, I really appreciate having these opportunities over many years to be able to appear on the show and reach out to the community, because that's one of the things we know, that we have to use all the media that the community uses, not just the media that we're used to using if we're going to get our messages out. And I think that you all have contributed a lot to the fact that so many county residents have actually followed the guidance on COVID. When I go out, I see people masked up. And being masked up has, I think, helped make our numbers lower than other places, because people in this county take it seriously, and you help make that possible. So thank you.
Thank you, Mr. County Executive. Rapidito, antes de que nos saquen del aire, pues a través de los años ha apreciado estas oportunidades de poder comunicar a través de los medios de comunicación utilizados por la comunidad hispana, y que a través de estos medios precisamente nuestra población ha seguido todas las pautas necesarias, como el utilizar la máscara. No se olvide, póntela bien. Gracias, señor Ejecutivo. Muchísimas gracias y muy buenas tardes para todos.
Muchísimas gracias. También.
Gracias.
Hasta luego.
Hasta luego.
Y hasta aquí su espacio,